And now, let me give a brief introduction. Dr. Tejas Gundewar, who is the Chief Male and Female Fertility Consultant in Ruby Hall Clinic, Pune, is here to talk about the topic Women and Health. This young dynamic doctor happens to be Maharashtra's first NCH in the field of reproductive medicine and surgery, and one of the very few in the entire country. He was one of the 4 doctors selected from the entire country for this prestigious Medical Council of India recognized degree course and was awarded a gold medal for his performance. He was also awarded the prestigious degree of MRCOG from London. He has special training in male infertility from University of Miami, USA. Moreover, he has special interests in natural pregnancy in couples with failed RUI and IVF cycles, male and female surgeries for natural pregnancy, advanced male infertility treatment and surgeries, among many others. So with this brief intro, may I please invite Dr. Tejas Gundewar on stage.
So, very good afternoon to all of you. I am Dr. Tejas Gundewar. I am a Chief Male and Female Fertility Consultant in Ruby Hall Clinic, Pune. So, first of all, let me thank IITM for giving me this opportunity to speak on women's health, and obviously Ruby Hall Clinic for giving us the opportunity to interact with all of you. So, what I'm going to do today is bring to you a concept of what is called as a one-stop fertility solution for male and female infertility. I'll keep my talk very crisp, and I'll show you a few examples and how we've managed few patients and getting them pregnancies and getting them kids. Infertility in India is a very challenging thing. So for those who do not understand what infertility is, it's inability to have a baby. Okay, so they are not able to conceive, they are not able to become pregnant. And all the elders sitting here would definitely agree with me, and the youngsters also would agree with me that in India, infertility, not having a baby, is still a big stigma. Unfortunately, it's a stigma. I mean, infertility, like any other thing, say for example, diabetes or anything, it's just a problem that you're facing. Okay, there's no reason why we should stigmatize this, but unfortunately, that's the society we live in, and that's how we have to go through it. Nevertheless, so we present here a one-stop fertility solution for all couples who are suffering from infertility. And thank you, ma'am, for such a kind introduction. So after doing GYNAC, I did MCH in reproductive medicine and surgery. So it's a super specialty degree after doing GYNAC, and I happen to be the first gynecologist from Maharashtra to have been awarded this degree. So thank you so much. And along with this degree, I was also awarded a gold medal for my performance during these 3 years. And apart from that, I did my special training in male infertility from University of Miami, USA. So now I'm going to talk to you regarding a concept of one-stop fertility solution. But before I talk to you about the concept of one-stop fertility solution, I want you to understand how natural conception occurs. And I'm going to show you a video. So a story of natural conception. So whenever there is a sexual contact, you will have lot of sperms that go towards the egg. Okay, and a lot of sperms stick to the egg, but only one sperm is going to make it inside the egg. All right. And as you can see in this diagram, on the right side of the screen, you have the female reproductive system. That is, the uterus is there. Besides this, tubes are there. Besides the uterus, you have the ovaries. On the top left of the screen, you will see a lot of sperms going towards the egg. At the bottom left, you will see one sperm entering the egg, and then this will come back. So this happens inside the tube here, and then it comes back and sits inside the uterus, and that's where it keeps growing. Okay, and that's where the baby grows. So now, before I take you to the concept of one-stop fertility solution, let me tell you what we do as a part of one-stop fertility assessment. So, if you've seen the story of natural conception, you would understand that if we talk about natural conception, what is required from the male partner? What is required is you need to have good sperms. So the sperm count needs to be good. The sperm speed needs to be good. And what you can see on the screen are the sperms which are moving well. You have a lot of number of sperms are there in that video, and then you have another one where you will see less number of sperms. They are not moving properly. So as a part of the assessment, the first thing we do is check the male partner, see the sperm, see the semen analysis, check how the sperms are, see how the speed is, and we also show it to our patients that this is the problem. What do we do for the female partner? So now when we talk about the female partner, what is required for a female partner? The uterus needs to be good, all right? So now what we do for the female partner? So this is how we do a sonography. As you can see on the screen, that's the uterus. The three lines that you can see inside that is called as the endometrium, or you can say that's a cushion in which the baby sits and grows, or the small baby is going to sit and grow in that. All right. We also do what is called as a 3D sonography. So we also do what is known as a 3D sonography. So what do we do in this 3D sonography? What we assess is how's the uterus. Can the uterus take up the pregnancy? Is there any problem in the uterus? So this is a most recent way how to assess the uterus. Okay. Now next thing what we do is when we come to the female partner, we also need to understand what is the body's egg producing capacity. Okay. So that is called as an ovarian reserve. So what do you do in this is, so now what you can see on the screen with black things, those are the eggs that are there inside the female partner. Okay, those are the eggs, and out of these eggs, one egg is going to become big, it is going to rupture, and then if contact happens during that time, it will result in a pregnancy. Now, what do we do next for the female partner? So this is called as a live HSG. Okay. So why is this done? It is done to see whether the tubes in the female partner are open or not. Okay. So we are putting some dye from below, some fluid is put from below, and we see whether the tube is open or not. Okay. So this is the concept of one-stop fertility assessment. And why do we do this? It is because as I said, that infertile couples go through a lot of stress. So what we are trying to do is we are trying to give them an assessment in one step. That is, the couple comes to us and we assess both the partners at the same time to understand why are they not having a pregnancy. All right. So now, so the next thing is now I'm going to talk to you about a concept of one-stop fertility solution. And before that, I'll take you through a few things that if the young population, if they are undergoing fertility treatment or anything, they will understand that IUI is one part which is done. Okay, so IUI means cleaning the semen sample, putting it inside the female partner. That is called as IUI. That's one way of achieving a pregnancy if a couple is not able to have a pregnancy. So now I do get a lot of couples who say that IUI has failed or IVF has failed. So what do you do? What should I do if IUI fails? So does this mean that you have to take some higher treatment and you have to go for IVF or test tube baby? No, it does not mean that. So I'll take you through few of my reviews on Google. So there are stories where patients have had failed IUI cycles and they have come to us. Now this patient had infertility for 4-5 years. She had 3 IUI failures before they came to us. And when we assessed the couple, we thought the only problem was the female partner was having PCOS. That is, she was not able to make the egg properly. Now, that was the main concept of assessing that why she was not having pregnancy. So we treated that, and to our surprise, and to not our surprise, but yeah, whatever means with correct treatment, she had a pregnancy. She delivered a baby boy. All right. Now this is another patient again. Three IUI failures outside. Now this patient, female male partner had a problem. Male partner, the sperm speed was not up to the mark. So what we just had to do was we didn't do another IUI. We just had to work on sperm speed. We had to tell some dietary modifications to the male partner, give some medicines, and that was it. And this couple again conceived with natural treatment, basic treatment was required, but the thing was understanding what the problem was and give treatment accordingly. And this couple delivered a female baby. All right. So now, so if IUI fails, I told you what to do, right? Now, the thing is, what if IVF fails? Now, IVF is considered as the last treatment. If from a layman's term or common man's term, we can call it as test tube baby. Yeah, majority of people you must have heard. So what a test tube baby is, right? So this is considered as the last treatment in fertility, or those couples who are not having a baby. So now what do you do if IVF fails? So again, don't get stumped if IVF fails. It's not the end of the road. There is always a ray of hope. I'll take you through a couple of stories. So now this couple, this patient, as you can see on the screen, there was some problem in the uterus. You could see some black dots are there. So there was fluid filled spaces inside the uterus, and she had PCOS also. That is, she was not able to make eggs. She had one IVF failure. So what we needed to do for this couple was treat her PCOS. So these are what you can see on the screen are the ovaries. So these are the ones that produce the eggs. Okay, so what we did for this patient was we made some small holes inside the ovary. The second thing we did was we drained those fluid areas inside the uterus, as you can see here. So we are draining these fluid areas inside the uterus now, and then gave her basic treatment, and then this patient conceived. Okay, so now this patient conceived. Although this patient had an abortion, but this patient had 7 years of infertility. She had not conceived up till now. Never ever she had conceived. She had had a failed IVF, but a correct treatment, correct understanding what the problem was, and giving treatment gave her conception. Though it ended in an abortion, but at least it gave them the conception. So the concept is understanding what the problem is and treating accordingly. Another patient, 3 IVF failures in an army hospital, came to us. We had to give her treatment for natural conception. She conceived, she delivered vaginally, and we did a normal delivery for her. So this is again a shift in our treatment, that if you conceive after treatment does not mean you have a C-section or a cesarean section. You can still deliver normally. So that's what we want to change the concept. This patient again, this patient had 2 IVF failures, and now for this patient we had to do an IVF again. We did an IVF for this patient because there was no possibility of giving any other treatment after doing an IVF, after doing something called as an intrauterine PRP, because the uterus lining was not good. She again conceived, and then she delivered. This is my team with the mother and the baby. All right. So now I'm going to talk to you three stories of one-stop fertility solution, that is treating the male and female partner together. So now this was a couple that came to us. This was a German couple. The female partner was Indian. The male partner was German, and they were trying for conception for 1 year in Germany. Okay, so they came to us. As discussed, we did something called as a one-stop fertility assessment. And to our surprise, there was no problem in that couple. Okay, there was absolutely no problem, and the semen samples, sperm parameters were too good. Means I remember telling that male partner that this is one of the best semen samples I've seen from such a long time, because I keep seeing bad semen samples, because I get all patients who are very difficult cases. So that's what I did. I just told them that there's nothing to worry. everything looks perfectly fine. You just have to relax and do nothing about it. And then 3 months after they had a consultation with me, I get a message on my WhatsApp and telling me that doctor, next month we conceived. And they send me a sonography picture saying that they were 3 months pregnant. So not necessarily that you need to treat always, right? You just need to tell people that, okay, there is nothing wrong with them. They can have a natural conception. They can have, nothing needs to be done for them. That's what is required at times. All right. Now, this is the case. There is a second patient. This was a couple with 12 years of infertility. That is, they had never had a baby for 12 years. And we were planning to do an IVF for this patient. Male partner had a problem, female partner had a problem. So as you can see on the screen, the female partner's uterus was a little smaller. It was a T-shaped uterus. So what we had to do is cut on the sides of the uterus. Now, don't take me wrong. This was not the reason for their infertility. That is, they were not. It was not that because of this they were not conceiving. It was because the male partner semen parameters were not good. And then at the same time, we treated the male partner as well. And to our surprise, we did not have to go for an IVF cycle. Treating both the partners at the same time gave them a male baby. So they delivered a male baby after some time. And this is a review from the same patient telling that they were trying for 12, 13 years, and then with once of fertility treatment, once of fertility solution, they conceived. Now, this was an extremely complicated case, extremely complicated case, and we are super proud as a team to have overcome this case. This was another patient with 2-3 cycles of failed IVF. We planned a cycle again for them. Male partner did not have sperms. So this thing is called as azoospermia. That is, where there are no sperms in the semen that comes out of the body, but there are sperms inside the body. So what we did and what we had for the female partner was her body's egg producing capacity was very low. So what we did is, you can see there were a lot of stickiness inside. So we had to remove this stickiness and we removed this stickiness. The next thing we did was, I can show at the end of the video. So you can see some needle going inside the ovary. So this was called as ovarian rejuvenation. So ovarian rejuvenation is a concept where what we do is we take out the blood from the female partner, we process it, and only the white cells, that is the platelets, are put inside the ovary. Okay. The ovary, inside the ovary, a needle is going, and then we put something inside that. So the processed blood is put inside the ovary. All right. And then what we did for the male partner is take out the sperms from the testes. We made the embryo out of it. That embryo was put inside the female partner, and then this was a super duper happy moment for us when the results came out to be positive. After a few weeks, sonography was done to see whether the heart activity was there in the baby or not, and yes, it was there. So that's what we do. We run a program which is called Infertility to Parenthood. In Marathi, I call it as Vandhatva te Matrutva. As a part of this program, we run something called as Pay Once and Get a Ticket to Parenthood. Ek 10 paise bhara, padhne ki tayari kara. So this is our guarantee that we will give you a conception in whichever way it is possible, either natural conception or IVF, whichever way it is possible. So as from my team, Team Doc ICG, what we do is we give a one-stop personalized fertility solution. Giving natural conception is our hallmark as a trademark. And these are numerous photos of my patients delivering their kids, with some with natural conception, some after IVF, and a few happy patients where surgeries have been done. So this is what we offer as a team. Natural conception treatment, male and female infertility treatment, male sexual dysfunction, basic IVF, advanced IVF for those patients who have failed IVF. This is something new that we have started doing, me, cancer and fertile future. So that is giving fertility treatment or preserving fertility in those patients who are undergoing cancer treatment. because cancer medicines will reduce your chances of becoming pregnant. Those patients who have recurrent abortions and the surgeries that have already shown to improve the fertility. So I'm available in Ruby Hall Clinic Monday to Friday, 1 to 5 p.m. You can approach me whenever you want, if at all you want. And would like to give a social message. Please, please, please save water, save paper, and say no to plastic. On that note, thank you so much for a patient hearing. These are my contact numbers. If anything, if any question, I'm ready to answer. Thank you so much for a patient hearing.
Thank you, Dr. Tejas. I request you to collect a memento as a token for appreciation.
Yeah.